Good morning, afternoon, evening to all the participants who are attending this global colloquium. As we all know that we had decided to start the colloquium on 10th, but due to overwhelming response from the audience and along the speakers, we have given a special place for the poster presentations so that the speakers who wanted to present their posters as oral presentation, they also get an opportunity to share their experience and views with the audience. So today the session is on the main theme of today's session is case reports, observational, pragmatic and randomized control trials. And the sub-theme for today's session is case reports and cohort studies of miscellaneous disorders. As we all know that the gold standard of any research or study is randomized control trial, but case reports are equally important in our repository as far as medical science is concerned. As case reports are very important for advancing my medical scientific knowledge, especially of rare diseases. We know that there are clear limitations to the methodology of case studies in determining the treatment and establishment of new medicines or new treatment protocols, but the observation of a single patient or a series of patients can add to our understanding of etiology, pathogenesis, natural history, and treatment of a particular disease or a rare condition which is not seen by many physicians. So today we have specially dedicated this session on case reports and case studies for other disorders or rare disorders which are commonly seen in the clinical practice. For today's session, we have our esteemed guest and chair for this session is Dr. Seema Rai. Dr. Seema Rai is professor and principal in Dr. B.R. Sur Homeopathic Medical College, Hospital and Research Center, New Delhi. She is postgraduate in Materia Medica and she has a vast experience of more than 30 years in academics, patient care and administration. I welcome you, ma'am. And if you
Thank
have the
you. Good morning. Good
if you
morning,
have
everyone.
if we have the permission of the chair, we can proceed with our sessions.
Yes, you can proceed.
So myself, Dr. Meeta Gupta, and my colleague, Dr. Archana Narang, are moderators for today's session. Now I will request Dr. Archana to proceed with this session.
Good morning, Adab, and Namaste to everyone. So I'm starting with the opening presentation by Dr. Rakesh Gupta. He is working as Associate Professor at Shrimati CMPH Medical College and Sattva Charitable Sanstha, Mumbai. He will be presenting on case series on acute diseases and its homeopathic hospital management. Dr. Gupta.
Hello, ma'am. I'll begin directly with the presentation. Can I share my poster, ma'am?
Yes, please.
Is it visible, ma'am?
Yes, it is visible.
Yeah. So my presentation today is case series on acute diseases.
Dr. Gupta, can you please enlarge it a little bit?
So this is a case series on acute diseases which were presenting with fever in the hospitalized patient. So this study was conducted in the year 2014 till 2019 for the patients who were hospitalized at Sri Mumbadevi Homeopathic Hospital, which is located in Mumbai. So actually the background, what impressed me about the study was that there are a lot of acute cases which are presenting to us in and day out in our clinical practice. And many of them we are not able to do justice because there is a requirement for the change of remedy. It requires observation. And many a time they are in state of depleted vitality, which needs to be corrected by giving various auxiliary and ancillary line of treatment like IV fluids and all, and proper monitoring and follow-up assessment. So that was the reason I started doing this study. So during this study, when it was actually there were 1,003 patients which were there during this tenure. They were admitted in our hospital. Out of 1,000 three patients. If you can see in the center, there is a chart. Out of the 1,003 patients, around 654 patients were presenting with fever. So any disease, whether it is infective, inflammatory, or involving any system of the body, the 654 patients had presented with fever. Out of 1,003, 349 patients did not have any febrile presentation. So these 654 patients were intervened by giving various homeopathic medicines depending on the standardized case-taking format, totality construction, and remedy differentiation and final remedy selection in various potencies depending on the state of susceptibility of the patients who were admitted and presenting with these symptoms. So it was when we were doing this study, the inclusion criteria for this study was all the acute diseases which were within the interval of 7 to 15 days, or any exacerbation which had the interval of 7 to 15 days of any chronic disease, both sex. The exclusion criteria in this were the neonates, pregnant women, because we didn't want to get into any ethical issues, and patients who were presenting with acute cardiorespiratory dysfunctions, or any individuals who were on any life-saving devices or any kind of interventions which were going on. And patients who were opting out for allopathic treatment were not included in this study. And the platelet counts dropping below 20,000 was not taken in this study, and the WBC count above 18,000 and all, these patients were also not included into this study. So these were the inclusion and exclusion criteria. And after we underwent all the various steps, it was over a period of 5 years. What we saw is, out of 654 acute cases, 582 cases recovered and were cured with homeopathic line of treatment. There are around 11% cases, that is around 72 cases out of 654 patients did not respond. Either they opted out to go for allopathic line of treatment, or they were diagnosed with some kind of diseases which required some kind of intervention, or there was some group of patients where we had found that they were there was a drop in the oxygen saturation, and they would have required an ICU transfer and admission with interventions in form of ventilatory devices or assisted ventilation. So there were around 11% of cases, and few of them landed up with diagnosis of cancer, and which required a surgical intervention. So these were 11% patients. So the what we understood, the conclusion of this study was, basically it had started with an aim of the study was to understand the efficacy of homeopathic line of treatment in various acute diseases and fever, and understand various clinical states and clinical patterns, and understand the susceptibility in these acute cases and treatment protocol, and to understand what is the response of the various homeopathic medicines at different stage of the disease which the patients were presenting. So overall, when we started doing it, the conclusions what we could draw is, there were majority of cases who had come to homeopathic line of treatment with acute fevers were belonging to respiratory system and infectious diseases and urinary tract diseases and GI tract. So around 23% was infectious diseases, 21% was respiratory system, 16% was urogenital system, and 18% was GI tract. So this was a majority of the thing which you could see. Then we found that mild to moderate degree of cases and pathologies responded well to homeopathic line of treatment. And there were cases which was belonging to cardiorespiratory emergencies, required interventions and ventilatory support. So they were not responding well to those our homeopathic line of treatment because of the lot of restrictions and restrictions of giving and administration of the medicines. So it was not possible. Then amongst the infectious diseases, most commonly, treated diseases were dengue, viral fevers, chikungunya, and enteric fever. Surprisingly, it was found that malaria, although it led to the discovery of homeopathy, malarial patients in urban setup, it was very difficult to give homeopathy because they were already given anti-malarials, and many a times the pattern of fever would be, cotton, tertian, or this led to a lot of difficulties in tracing the picture of the disease because patients were better during asymptomatic phase. Last conclusion which was studied was if the vitality is deranged within mild to moderate range, then it becomes easier for us to intervene homeopathically along with auxiliary and ancillary line of treatment where the cardiorespiratory status is intact, where the even if the biochemical reports are abnormal, like serum creatinine, electrolytes are imbalances there, or even the WBC count is little elevated. So all these cases can be treated really well. But in once the patient goes into a complete state of suspended animation, it becomes difficult to revive in because of the restrictions of giving medicines in ICU setups and the administration of timely because we may have to according to the organon of medicine we need to give it very frequently. So this is my short study which I wanted to share with the with all the panelists and the judges and the moderator. I would like to acknowledge the General Secretary of our institute, Dr. Asmita Parikh, our principal, Dr. Damania, my senior colleagues, Dr. Devadika sir, and Dr. Nimish Mehta sir. So thank you. I'm done with my presentation. I would like, if there is any discussion, I am ready to answer the questions, ma'am.
Thank you so much, Dr. Rakesh. Um, Now I will request the chairperson to ask any questions. Ma'am?
Dr. Rakesh, as you said, you are decided mild to moderate degree of the cases. On
Yeah.
what basis you have selected this case is mild, this is moderate?
Yeah, ma'am. The only criteria which I have mentioned in the exclusion criteria also, the criteria is like if there is cardiorespiratory dysfunctions, like there are patients who come with, example, I would give the chest pain, and if they are found to be drop positive and also, and with the cardiorespiratory dysfunction, like there is a drop in pressure or there is a cardiorespiratory distress where respiratory rate has been increased above 25 and all, so we had to, we have excluded them from the study because they may require intervention by ICU admission and other form of treatment. This was one criteria. Second was a platelet counts dropping less than 20,000. According to
No,
me,
that is okay. That is exclusion and inclusion criteria
yeah,
you
ma'am.
have mentioned.
Yes,
But on the symptomatic basis, on some basis, that will be excluded. Definitely, these type of cases will be excluded.
yeah,
But
ma'am.
for mild to moderate cases which you have taken, on what basis you have segregated? Try to segregate. These are the mild, these are the moderate, which we are going to treat, or just on the basis of exclusion criteria you have ruled it out.
Yeah, we on the basis of exclusion criteria and symptomatic presentation, madam.
Okay. And can you please tell me on what basis you have given the prescription, whether it is on the basis of the acute totality or whether you want to give them some constitutional, or on what basis you have selected, or some these type of diseases are there and you want to give this medicine, some specific or research you have compiled the result and then you have start giving.
Yeah, ma'am. So I'm sorry, there was a limitation of the poster, so I could not include all.
Definitely,
Yeah.
definitely.
So, madam, the selection of the remedy was first of all based on the totality which the patient presented. So, in this case, I had given more importance to the causation, generals of the case, and the tissue location. And if in constancy, madam, when the patient presents with an acute, we always go with a phasic approach. And once the patient is a little bit settled, then we go for the constitutional case definition. So it has been found that around 10 to 20% patients, we had seen that the constitutional is remedy is also covering the acute phase remedy. So we that 20% patients were given the constitutional, which is covering even the acute phase, and remaining were given madam phasic prescription or the acute disease whichever they had presented with. So we had not selected any particular remedy like dengue should be given only eupitorium or something like that. So we had always followed the individualistic approach.
Okay, like you have taken a good number of the patients selected.
Yes, ma'am.
So, in like if we take the example of the dengue fever,
Yeah,
are
ma'am.
you able to come up with some of the remedies? You are able to shortlist some of the remedies in that study.
Yeah, ma'am. So in dengue fever, the remedies which were coming up most commonly were Bryonia, Rustox, Sepia, Pulsatilla. These were the four remedies which were coming predominantly. and eupyduria was, although it was coming, but not very frequent. The reason was the individualistic features were much more higher in intensity compared to the pathognomic symptom of dengue. Like, body ache is a very predominant symptom of dengue. So all patients who were coming with dengue, they had body ache. So we had considered the more individualistic symptoms, like thirst was a very important factor which we had considered. Nausea, vomiting was another associated factor which we had considered during the symptomatology and history taking and totality evaluation.
That's okay. That's okay, Dr. Gupta.
Yeah. Thank you, ma'am.
Okay. Good.
Thank you, Dr. Rakesh Gupta. So moving on to the next presenter, may I now invite Dr. Pooja Nayanesh Bhai Bhatt. She is working as reader at Dr. V.H. Dave Homeopathic Medical College, Anand. She will be presenting on Homeopathy for Management of Acute Diseases, a case series.
Good afternoon. My greetings to Dr. Seema Rai ma'am, Dr. Archana Narang ma'am, and Dr. Meeta Gupta and all other fellow doctors. Myself, Dr. Pooja Bhatt. Today I am going to present 5 acute cases with 5 different pathologies and its homeopathic management in context of duration of the treatment. So, as we all know that acute diseases are very sudden in onset and having a severity in its intensity, so it usually enable the patient for the day-to-day activities and torments the patient. So immediate medical attention is required to give relief to the symptoms of the patient. So here in 5 cases I have taken visual analog scale to measure the severity of the symptoms. So my cases are already symptoms are given, so I'm skipping to the prescription part. My first case is of acute appendicitis of a 41-year female patient. On 16th of July, patient was already came with the USG findings in which patient had acute inflammatory changes of acute appendicitis. So I have given Iris 10x on my first prescription because of presence of common symptoms of acute appendicitis with that of increased thirst and dry mouth, which is characteristic of Iris 10x. And also Dr. Clark in his prescriber book, he suggested that Iris 10x is the most specific of all appendicitis medicine, and you can begin the treatment with this medicine when no other guiding symptoms are present. So after patient was better in pain, again on 26th July, USG was repeated, and in that no changes of acute appendicitis was there. I have concluded my case by giving Lycopodium 1 m 1 dose, as patient was having the right-sided affection and still patient on a USG finding renal stone complaint was still remaining. And Dr. Gupta in his book has said that when the acute attack is over or in recurrent acute appendicitis, you should give Lycopodium 1 m dose every week. So I have concluded my case with Lycopodium 1 m 1 dose. My second case is of 5 years young male patient of acute urticaria. In that I have given Rustox because on the basis of the symptoms that all the symptoms of acute urticaria was commonly present, but with that warm bathing gave relief to the patient. So in a complete repertory in a skin chapter, itching better by hot water, only 2 remedies were given, that is Rustox and Rusvein. So I have given Rustox on basis of modality. Here I have concluded my case with the tuberculinum 1 m 1 dose because patient has a past history of eczema and also strong family history of tuberculosis with a tendency to catch cold on every change of weather. My third case is of allergic contact dermatitis of 32 years female. Here I have given Apis mellifica because of the presence of skin complaint with excessive burning and stinging pain, and patient's affected part was hot on touch and excessive excessive sensitivity to touch. So Apis mellifica was given, and I have concluded the case with Sorinum 1 m 1 dose because to prevent the recurrence of the condition and to cure the complete the cure of acute disease. My fourth case is of erysipelas of a 59 years old patient. Here I have given belladonna because patient was coming with the all the symptoms of erysipelas with the high fever. So early stage of erysipelas with fever, and especially on the lower part of the body, which spreads very rapidly. So this suddenness, acuteness, and violentness and increased intensity, which characterizes the belladonna, and as well as it was characteristic of my patient too. In a fifth case of injury, a 30 years female patient came with the history of fall, and after that patient has developed bruise with excessive tenderness, and patient cannot move leg because of the pain, and even she cannot put the leg down to the floor. So arnica, as we know, that it's the best injury remedy, which helps to promotes the absorption, plus extreme sensitiveness to touch, and pressure is also there in the arnica. So arnica was given. Now, if we see the graph, then in my case of acute appendicitis, here I have given the severity on the VAS scale and in how many days patient get better. So in acute appendicitis, severity was at the level of 8, which came down to 0 within 6 days of treatment. In acute urticaria, as we know, according to standard literature, urticaria remains for minimum 6 to 24 hours, and the attacks repeated in a daily basis. In our case, severity was 10 and it came down to 0 within 1 day without having any recurrence till date. My third case, allergic contact dermatitis, having severity of 6 on VS scale, which came down to 0 within 10 days. My fourth case is of erysipelas, in which severity was 8, came down to 0 within 6 days. In cases of erysipelas, according to standard literature, it goes off by its own, but it takes many weeks to months to disappear. And by that time, if treatment is not given, then it can give rise to abscess formation, and it goes deeper into the tissues. And recurrence rate of erysipelas is in 30% of cases. So this patient also not getting any recurrence of the complaint till date. And last case is of a trauma, in which severity was at 10 and it came down to level 0 within 7 days of treatment. So in all these cases, antibiotics or analgesics or antiviral drugs or anti-allergic medicines are not required to give during this duration of the treatment. So on the contrary to common belief that homeopathy acts best in the chronic diseases and it takes too much time to heal, here we can see that acute diseases, homeopathy acts best in acute diseases, and that is also within very lesser period of time. So as Dr. Honeyman has said in aphorism number 2, that cure can be achieved in a rapid, gentle and in a permanent way in acute diseases as well. Thank you for listening to me. Ma'am, any questions or something? I'm open to any questions.
Thank you, Dr. Very nicely case series. Now I will request Seema Rai to please ask the questions. Ma'am, do you have any questions for Dr. Pooja?
I'm Dr. Pooja. We will
Yes,
start
ma'am.
from the last case in which you have
Yes, ma'am.
given patient is having history of fall and you have given the arnica. Okay.
Yes.
And in that case, you said the patient is having swelling at the right big toe. Okay.
Huh.
After that, although you have given the arnica case, patient complaint subsided, but you have tried to find out that only great toe or some investigation to rule out it could be patient may be having any gout or any investigations will be done to increase uric acid level, or how long you have followed these cases till
Yes, ma'am.
date?
Yes, ma'am. In fifth case, patient had fallen. After that, immediately patient go for a chest X-ray of that toe, and X-ray was normal. And after that, orthopedic has given her some that analgesics. So patient was like, I don't want to take painkillers, so she came to me, and after that I have examined, and patient was having a severe pain even on the movement, and that greenish discoloration was there on the toe. So
Okay.
that's why I have said that it is an
And
injury
how
case.
long you
And
have continued with the arnica?
ma'am, that is for 7 days, ma'am. As a patient was better in a pain as well as in a bruise, I have stopped the medicine.
Okay, and that swelling also subsides in that case.
Yes, ma'am.
Okay, then coming to your fourth case, that is of the erysipelas. No?
Yes, ma'am.
In most of the cases, what I was recollecting, you are giving like first the acute medicine and then followed with whether it is nosode or constitutional basis. No?
Yes,
So
ma'am.
you have tried to find out ki maybe in the acute case also the constitutional may be the remedy, or at that moment you have just tried to give the only the acute remedy. What was your
Yes,
aim?
ma'am.
You just try to give
My
the acute remedy so the patient will be having, because many time it may happen ki constitutional remedy which we select, that may be acute in that case, acting as acute in that case, right or wrong?
yes, ma'am.
Because like in the barbaris, it could be given if the symptoms are there, it help in relieving the renal colicky pain acutely, whether 200 or 30 we will give on the symptom, or we can give it as organopathic remedy also. So same way, like you have selected whether serinum or whether lycopodium, it could be in the way ki lycopodium could be the acute remedy. Lycopodium is also one of the very good remedy for appendicitis. Excellent
Yes,
results
ma'am.
are there. So lycopodium, maybe the picture of lycopodium acute phase could be for the patient. You have tried to find out those things, or just aim was this ki acute case, first acute medicine, then followed with the constitution? What was your aim?
Yes, ma'am. I have almost I do like that. In acute cases, I take acute totality and acutely superficial acting medicines. Usually, I have given, and then I have completely taken the full case. And after that, I have given anti-miasmatic medicine to prevent the recurrence of the case.
Okay, like in the second case of the urticaria, you have given Restox. Okay, for how
Yes, ma'am.
long you have given the Restox to the patient?
Ma'am, only every 15 minutes I have given for 1 hour. Then patient was better in eating, and wheels were also subsided. So
Okay,
Rustox was not given after that. Then I have
okay,
taken the full case, and I have given tuberculinum 1M1 dose. So because patient has had an history of he got when he was playing with the birds. So because of that, I thought that again that can be occur, because that patient
okay.
had a bird in his house.
Okay, how long, whether first time the patient came to you with the urticaria or earlier also the patient is having, because urticaria, many times the attack occur, acute exhibition of the symptoms occur, but patient will say ki I am suffering from this off and on. So whether this is the first time patient came to you or he was having the tendency for that.
No, no, ma'am. This is the first time when patient came to me
Okay,
with this complaint. Huh.
with this complaint. And after
Hmm.
that, the patient is, you have given the tuberculinum 1 dose. After that, the
Yes, ma'am.
patient didn't turn up to you because the age is just 5 years. So patient
No, ma'am.
didn't turn up to you, or
I
you are
still follow
following.
that case. And
Hmm.
he is having no complaint. So, but his mother calls me and tell me, he's okay every month. Because I
Okay,
have suggested that, tell me if any minor complaint also he is having.
okay. So no other complaint, whether as the child is
Uh,
having tendency for cold, cough, coryza also, that was also better.
this even in this from monsoon is this winter is approaching, so again she called and I asked that if he is having certain coryza kind of complaint, because he was having it at every change of weather, but he was not having in this season
Okay.
that
And
complaint.
what is the justification for the apis which you have given in allergic dermatitis? And in
Allergic
all
contact
those conditions,
dermatitis.
like whether it is allergic dermatitis or urticaria, you have suggested some investigation to the patient also to rule
uh,
out to he is allergic to what.
No, ma'am, I have
or in
not
urticaria?
suggested. No, ma'am, I have not suggested any investigation in this allergic contact dermatitis and in urticaria patient.
Okay, okay, okay. But this is my advice. You should ask the patient to go for the investigation. So if
Yes,
some precipitating factor is there,
right. Uh-huh.
whatsoever, whether it is in the urticaria or any allergic disorder, we can rule out that. Accordingly, it will be the better results. Okay,
Yes, ma'am. Yes,
that's my
ma'am.
advice. Okay, thank you
Yes.
then. Thank you.
Thank you, ma'am.
Thank you, Dr. Pooja. Now moving on to the next presenter. May I call upon Dr. John Franklin, who is the Part 2 student from Dr. M.L. Thavle Memorial Homeopathic Institute, affiliated to the Maharashtra University of Health. And he will be speaking on management of premature ejaculation by formulating therapeutic problem resolution biopsychosocial model, BPS model. Dr. John, you can start the presentation now.
John Franklin from Dr. Davle Homeopathic Medical College, Palghar. So my topic, is it visible, ma'am?
Can you expand it a little bit? Because
Yes.
you can then scroll and show the whole poster, no?
Yeah.
Yes,
Is it
better
visible
now.
now? Okay. My topic is management of premature ejaculation by formulating therapeutic problem resolution using BPS model. So the introduction, the basic introduction for the topic is sexual enjoyment requires both the partners to be able to achieve orgasm in bed. But the ejaculation less than 1 minute after vaginal penetration without sexual satisfaction for both partners is considered as premature ejaculation. So my aim of this study was to identify the causes for premature ejaculation and to formulate the therapeutic problem resolution to identify the similar homeopathic remedy. So as you know, all know that the ejaculation is a normal thing in the act of sex, but the premature ejaculation, which comes within less than 1 minute, it is according to the DSM-5 criteria. It is mentioned that the premature ejaculation occurs within 1 minute of sexual intercourse. So the methodology that we have take over is identification of 30 cases, 30 sample cases, along with case taking and recording and identification of causation, case processing, formulating problem resolution, prescription and counseling, and as well as observation for around 6 months after the intervention. So what are the methods we have followed were BPS model, that is the interaction of biological, psychological and social factors, and the diagnostic net, which is a tool, which is a 12 box 3 into 4 column tool, which is the tool which helps us to understand the patient and his or her illness in BPS components, and the therapeutic problem resolution, which is the tool which helps us to identify the exact resolution for the particular case. So we have identified, it is the important thing actually in a case of premature ejaculation, identifying the causes like biological, psychological and social causes. These are the very challenging thing to identify the causation. So we have identified so many causes according to the particular individual. Like biological, if we see that there are vigorous sex, heat of workplace, hypersensitivity of penis, other physical and after surgery, after a certain surgery like there are phimosis or something else, and there is injury to penis. So psychological causes we have identified where performance anxiety. This is the most commonly seen causes in the case of premature ejaculation. And there are anticipation, guilt, suppressed anger, disappointment, hatred towards partner, betrayal feeling, mortification, body shaming, suppressed sexual desire, forsaken feeling, grief, egotism, and lack of self-confidence. And the social causes that we have identified were poor sex education, cultural misconception, pornography, IPR conflicts, work stress, away from partner, because so many patients in our OPD setup, they came from other states and they are staying in our state for only for the work purpose. So they are away from the partner. So there were few accidents of sex at times, and there were social media, forceful marriage, and wife's infidelity also. So according to the biological, psychological, and social causes, we have formulated the resolution. Like for biological causes, we have advise the patient for second trial after first ejaculation, because the timing will increase according after the first ejaculation. And the support, we have taken the support of Kegel's exercise, stop start technique, squeeze method, and sensate focus. And for psychological and social resolution, we have identified so many counselings like sex education counseling, because there were lack of sex education also, and insight oriented therapy, education of normal sexual functioning, and REBT, like rational emotive behavioral therapy. So the medicines which we have identified there, we have selected the remedies according to the constitution, like constitutional remedy like lycopodium, silicea, natramure, calcarea silicata, staphysagria, calcarea fluor, calcarea carp, beretta carp, merxol, bellis pernis, natrum sulf, magnesium mure, and ferrum sulf. So according to the constitutional basis, we have intervened these medicines, and within 6 months of span, we have seen the improvement in the timing, like 30 seconds to 1 minute in 14 cases. The total, my sample cases were 30. In that, 14 cases were improved with 30 to 1 minute of timing, and more than 2 minutes of timing, 9 patients were improved, and 6 patients were improved for more than 5 minutes. So these cases were identified according to the basis of DSM-5, that they have the ejaculation within less than 1 minute. But after the intervention, we have seen that there were so much of improvement in their timing as well. And the conclusion part is various causes found in BPS component. So as I said earlier, the premature ejaculation cases have multi causation, like biological, psychological, and social. So I have mentioned here, like so many BPS components have been identified in our study. And then the identified factors guided us to formulate the therapeutic problem resolution. So it is a very important point to understand, because we cannot prescribe all the resolution for a particular person according to the biological cause. Like for example, if there is a performance anxiety for a patient, we have to give the insight oriented therapy as well as REBT, because we have to identify what is the anxiety that the person is going through. So then only we can understand and give resolution according to the problem. So for example, if there is a hypersensitivity of penis in a biological component, we have advised the patient for a sensate focus, which help the patient to reduce the sensitivity of the penis. According to that, we identified the BPS component, and then we give the resolution accordingly. And the third conclusion was observe the improvement in the ejaculation timing and control. So another one thing I missed, that the ejaculation control is missing in these patients. So we have observed in 6 months of time that the patients could control their ejaculation, as well as the timing has been also been improved. So this is my study about for within 30 cases. So I have to give thank you and acknowledgement for my guide, Dr. Mansi Surdi, lecturer of Psychiatry Department in Dawle Hospital, and our university, MUHS, as well as our college. Thank you. That's all my presentation.
Thank you, Dr. John. Over to Dr. Seema for any questions, please.
Yes.
Dr. Seema, ma'am, do you have any questions for Dr. John?
Yes, Dr. John.
Yes,
As this topic you have taken, I just want to know, like, detailed history is required in these type of the cases.
Yes, ma'am.
Okay, and patient cooperation is must. Otherwise, you cannot get the symptom and you cannot treat it.
Yes.
homeopathically. है ना? If some biological problem is there, then it is a different issue. Otherwise, psychological and the social, you have to work not only as a doctor, you have to work as a counselor also. So
Yes,
while
ma'am.
taking the history, you have some counselor also with you, or just as a homeopathic doctor who are very good counselor, you yourself is doing this?
Actually, ma'am, there is a procedure that we usually in our OPD setup, we used to take the case for around 2 hours. So for every cases, in order to understand the patient, we have to take the cases for 2 hours, like biological, psychological, and social. Every components will be covered. So
Okay.
as a homeopath, I can converse with the patient that they came for particularly for this problem only. So they are very open to talk like this. The doctor talk,
Definitely.
yeah. So
Okay.
after identifying all the causation, we have a counselor. There is a psychiatric physician in our OPD department. So I take the patient to that physician who is my senior. So
Okay.
we both consult each other and we provide the resolution accordingly.
Okay. And tell me one thing, you said constitutional, most of the cases you have given the constitutional remedy. है ना?
Yes, ma'am.
So with that also, you try to find out just the patient is better only for the complaint, like management of the premature ejaculation at that level, or you have tried to do the clinical verification of the other symptom also, which was there and for which you have given the this medicine, your constitutional medicine, because definitely the patient is not having the person, those who are having these type of the complaint, they must be having lot of other complaints also, not only premature ejaculation, just at the mental level, whether it is depression, anxiety. So lot of these condition are also there. So patient has improved on those level also. You have tried to find out all those things also, because it is not
Definitely.
reflected here.
Yes,
It
ma'am.
is just the
Yeah,
medicine
yeah,
which
yeah,
you have
yeah.
tried to find out. But like other symptom, whether they are cured or not, or any clinical verification was done.
Yes, ma'am. Actually, my exclusion criteria were diabetes mellitus, hypertension, erectile dysfunction, and some other hyperthyroidism. These are the exclusion criteria.
Hmm.
So I have taken the case and I have screened every patients with all the complaints, like whatever the cases it may be, whether they have some physical complaints like GIT complaints or some psychiatric components also like anxiety. In most of the cases, I have seen anxiety. GAD, general anxiety disorder, in most of the cases. So
Okay.
we have seen the improvement in that component also, because we are giving REBT, rational emotive behavioral therapy, as well as incentive oriented therapy. With that, we are not only treating the premature ejaculation, but also their mental processes as well.
Okay.
Yes.
Okay, doctor.
Okay. Thank you, ma'am. Thank you for the opportunity.
Any other questions, ma'am, or we move on to the next speaker? So let us move on to the next speaker. She will be presenting a case report. May I now invite Dr. Vinitha Susan Jacob. She is working as CMO in the homeopathic wing of Directorate of Ayush, Government of Delhi, New Delhi, India. And she is presenting on a case of beta thalassemia major in 1-year-old on regular blood transfusion and its marked improvement through individualized homeopathic treatment. A case report.
So good afternoon all. Can you hear me?
Yes, you are audible. Yes.
So here I would like to present here a case of beta thalassemia major in a 1-year and 10-month-old male child undergoing regular blood transfusion who had come to the Delhi government dispensary in August 2019. So before going into the details, let us first understand what beta thalassemia is. Beta thalassemia is an autosomal recessive inherited blood disorder characterized by reduced functional hemoglobin. There is an inherited mutation in the beta globin gene causing a reduced beta globin chain of the hemoglobin. Now, depending upon the severity of the case, it can be divided into 3 types. They are beta thalassemia major, which is otherwise known as Cooley's anemia. We have beta thalassemia intermedia and beta thalassemia minor, or beta thalassemia trait. Beta thalassemia major have a severe expression of the disease. They are typically diagnosed in the first 2 years of life. They require lifelong regular blood transfusion and treatment. Symptoms of beta thalassemia major generally presents very early in life. They include fatigue, weakness, pale skin, very poor appetite, recurrent infections, and over a period of time, you can see that the growth is slowed down. There is failure to thrive. There is abdominal swelling due to hepatosplenomegaly, and there is yellowishness of skin. But if it is treated, complications may arise due to iron overload. Like repeated blood transfusion can cause iron overload and cause tissue damages. The affected organs are heart, which can cause pericarditis and dilated cardiomyopathy. Liver inflammation can cause cirrhosis of liver, portal hypertension, even endocrine gland involvement causing hypothyroidism, and in rare cases, diabetes mellitus. Now let me come to the case proper. The case was diagnosed as beta thalassemia major when the child presented to me in August 2019. The case was diagnosed at 6 to 7 months of age, when the child had recurrent and continuous diarrhea and persistent weakness, and the hemoglobin level was reduced to as low as 2 grams per deciliter. All the diagnostic investigations were carried out at that time, like hemoglobin capillary zone electrophoresis of both the parents, which was suggestive of a heterozygous beta thalassemia. Other laboratory diagnostic test done at that time was complete blood count, hemoglobin electrophoresis, serum ferritin level, peripheral smear showing microcytic hypochromic anemia, anisopoikilocytosis, presence of target cells. These were the diagnostic criteria that were taken. Even the X-ray of the skull was taken to diagnose a case of beta thalassemia. Now, coming to the homeopathic medicinal intervention, in case of infants and small children, 2 things are essential to erect a totality. One is the history and the nature of symptoms as given by the parents, and second is the symptoms obtained by the observation of the child. Now, based on the above observations, I have selected the following symptoms to arrive at the similimum, which is phosphorus. Now, the indications are recurrent attacks of fever, upper respiratory tract infections, and diarrhea. This reference have been taken from the book, The Homeopathic Treatment of Children by Paul Hershque. There is intense craving for sour, which the parents have informed. The Ken's repertory, stomach desires sour, you have phosphorus as 2 marks. Then craving for salt, that is Ken's repertory, you have stomach desires salt, where phosphorus has got 3 marks. It's a chilly patient. And on general observation, you can see that the child was very active. So on reference from synthesis and the Murphy's repertory, we have got generalities, activity, physical, where phosphorus is indicated as 1 mark. Let me just. And the other rubrics are taken. Other rubrics are as weakness, that is generalities, weakness. Phosphorus is also of 3 mark. Then anemia, generalities, anemia in Ken's repertory, phosphorus is covering as a 3 mark remedy. Now, apart from phosphorus, I had also prescribed vanadium 30 and ferrum phos 3x have been administered through this treatment. Now, the indications for vanadium as taken from the pocketbook of Homeopathic Materia Medica by William Borick. Its action is that of an oxygen carrier and a catalyzer, hence it's used in wasting diseases. It increases the amount of hemoglobin, also combines its oxygen with toxins and destroys their virulence. Now, indication for ferrum phos is it increases the amount of hemoglobin. Now, as an intercurrent remedy, Syphilinum 200 was prescribed during the course of treatment. Now, in the result, I would like to highlight that in this case, I'm just trying to portray the marked improvement of symptoms of the case under regular follow-up for the last 2 years. and still is under treatment as on date. After individualized homeopathic treatment, there was a marked reduction in the recurrence of fever, cough, and diarrhea, with an increase in appetite, weight gain, and a corresponding increase in the trend in hemoglobin level. A weight gain of approximately 4 kilograms was noticed over a span of 2 years. So in this graph, I've just tried to display the hemoglobin level tested just before undergoing the blood transfusions. That is represented by the bars. The hemoglobin level is shown by the bars, and the line represents the interval between the blood transfusions. As you can see that during the 2 years of management, the hemoglobin level has crossed 10.5 grams per deciliter, 10 grams per deciliter, and if it is about 10 grams, they usually do not undergo blood transfusion. So twice you can see that the AIIMS Delhi have not advised for blood transfusion at 2 instances. So, and also the dotted line in the graph shows a slight increasing trend of hemoglobin level. So, so I would like to conclude that conventionally, regular blood transfusion is the mainstay of treatment, along with iron chelation therapy for beta thalassemia major patients with severe anemia. However, in this case, marked improvement was achieved during using homeopathic intervention without so far requiring iron chelation therapy. I hope this presentation would serve as a basic reference for homeopaths for management of beta thalassemia major cases. But of course, future research should be done incorporating several tests like serum ferritin level, hemoglobin electrophoresis test, and DNA test have to be done for HBB gene to better observe and analyze the result. So with this, I would like to conclude my talk. Thank you.
Thank you, Dr. Vinita, for such an enlightening case. Over to Dr. Seema Rai for any questions, please.
Dr. Vinita, as this case of the beta thalassemia, which you have taken, the age of the patient was about 1 year and 10 months. Okay?
Yeah.
And now what is the age of the patient?
Now he is 4 years of age.
Now he is 4 years old. When you have taken this case, how long and after how much time he has to go for blood transfusion, as he was diagnosed at the age of 8 months?
Yeah, definitely.
So, so how long he has to go from it came to you after about a year, you can say.
Yeah.
8th
definitely.
month he was diagnosed.
Yeah.
So in between 8th month and 1 year, 10 month, when he came to you, how many times he has taken the blood transfusion?
Yeah. So actually, ma'am, the child, when he was 6 months of age, he was in Patna in Bihar, and there they somehow came to diagnose it as a case of beta thalassemia. But due to certain difficulty, they were not able to do the regular blood transfusion. They were not able to get, because they were from a very low socioeconomic background, and they were there was difficulty in doing the blood transfusions. So they had to shift to Delhi. They came all the way, and they are settling in Delhi right now to undergo the regular blood transfusion from AIIMS Delhi. So the thing is, the child has to go from the graph itself. All these marks are indications of the interval between the like 49, 34, 23, 33. These are the intervals of transfusions that the child is undergoing. So after every, so but the defect is that we cannot really assess the improvement from this, because the dates are usually prefixed by the AIIMS. So
Definitely.
Get a date, and then they will go and do the hemoglobin. So from this, we cannot really assess whether the hemoglobin is improving. Sometimes it may be after 1.5 months they get a date. Sometimes they may, if the hemoglobin level goes down very low, then they may have to take another date.
So basically, on the basis of when the blood transfusion was given, on the basis of that, we cannot
we cannot assess.
We cannot say there will be improvement. But on the basis of the symptomatic, you are saying.
Definitely, ma'am. This
Okay.
is really asymptomatic, but what I felt is that in these two instances, but by previous records, I have seen that the blood hemoglobin level has not gone above 10 grams per deciliter. So the two instances, the patient was telling me that they went and did the hemoglobin level, and that was about 10, and they were asked to go back, because once it is about 10, they will not do the blood transfusion. So,
Okay.
so
Can you tell me one more thing? Like you said, the patient is having the symptom in the form of the fatigue or diarrhea. So, on the basis of some other symptom, you must have taken on the basis of, because on the basis of blood transfusion, as the dates were given, we cannot assess definitely. But the patient condition, on what basis you can say the patient is feeling better? Parents must have told you, you have observed something.
that
Can
is
you
a
point out those
recurrence.
things?
Yeah, actually the patient at the time before the patient was coming, even at the start of my treatment itself, the patient used to have was having regular fever, diarrhea, recurrent attacks was there in that patient, and the child was very weak. But what the patient told me was that after starting the treatment, over a period of 2 to 3 months, they could feel that at least that recurrent infections were not evident. I mean, slowly now, even now, the patient is coming to me, and the patient was saying, "Ki, ma'am, abhi to recurrence bilkul nahi hai. Once in a while, sometimes the patient do have fever, diarrhea, and all that, but the recurrence which were present before the administration or homeopathic intervention was much greater." So this is the point I would like to make in my presentation.
Okay. And just clarify one more thing, like when the patient has to go for the blood transfusion, or whenever the date of the patient is there, before that he must be, if you are regular in touch with the patient, must be coming to you also for the treatment also.
Definitely. They are
At
doing
that
alternate.
moment, at that moment, patient usually, what happened ki when there is requirement of the blood transfusion, usually before that patient gives you a lot of the symptom in the form of the great fatigue, weakness, exhaustion, syncope. These type of the symptoms start coming. Okay, so any these type of the symptoms were there, because they are very helpful in deciding the role of homeopathy also. Ki patient is not developing these type of the symptom to the extent which he was
Yes,
having
ma'am.
already.
Yeah, the one thing that was observed, what the parents told me was that when the hemoglobin level goes very down, just before transfusion, maybe 1 to 3, 4 days before transfusion, when it comes to very low level, the child does have weakness, and it manifests the symptoms of low hemoglobin. But otherwise, in general, the child is active, very active, and that is what another indication for selecting phosphorus as a remedy.
Okay, and what type of the mental picture these symptom you, I think most of physical
It's
symptom were
mostly
taken,
physical
mental level, because also the child and other symptoms which are there, which are going in favor of the phosphorus.
That is actually, at the time of giving the medicine, it was actually not repertorized, but seeing the patient and taking the case, we had given phosphorus, and later on, when on further reference to the literature and the various repertory, we have seen those phosphorus have really good indication for this case, and hence we have not changed that medicine. So it's
Means from last 2 years you are still continuing phosphorus. How much repetition was
so
given to this?
it is like been giving 1 m at an interval of 20 to 30 days, and followed by in between, I have said I've already giving medium 30 and ferrum phos. Definitely these have to be continued daily. So, and then this was improved to raised to 1 m, say we have increased to 10 m now, right now. So,
okay. So still you are finding that phosphorus should be continued.
Yeah, I think so. Otherwise, I have maybe if there is any indication, maybe I have to think. So I thought of presenting it. I would like to have a good comments on this, and so that we can help out these patients some way.
And definitely, definitely
Yeah,
these, because these are the what we can do.
yeah,
Although in these type
exactly.
of the cases, limitations of homeopathy are definitely there.
Definitely
But what
there.
best we can give to the patient, that is our aim.
Yeah,
Okay. And I
exactly.
think in this patient, you must go for the mental symptom also. Because I
Yeah,
have seen many cases of the thalassemia, these type of the cases, at mental level, patient are presenting with different sets of the symptom. Some gets anger easily, some gets indifferent, some
yeah,
wants to be pampered more. So with
yeah,
that different type of the picture, because these physical symptom which we have taken, definitely we will come up with the phosphorus and these type of the remedy, which will affect pathologically also, that
yeah,
is in its pathophysiology also. But if we take up the mental level symptom, then
yeah.
exactly we are better in a situation to come up with simlimum, and
Okay.
that will be more helpful for these type of the patient.
See.
That is my
Okay,
advice,
ma'am.
because I have
Thank
seen
you.
the cases. These are most of the physical symptom which were taken.
Yeah, yeah. It's just
So
mental symptom there.
definitely, you go for the mental symptom also, because various and many times not only the mental child is 4 years old, okay,
Yeah.
behavior problems and all these condition. Many times these type of the additional complaints which will come up in these type of the child.
Okay.
Definitely, child is also in a troubleful condition every time he has to go
Yeah.
for these blood
Definitely.
transfusion. Okay,
Yeah.
so these type of the whether psychological treatment is required in the form of the support and the
Yeah.
treatment, not only with the medicine, you have to do counseling of
Yeah.
the parent
Counseling.
also.
Definitely. That
Many
is there.
times
That
parents
is there.
were also
Yeah.
involved,
They
or
have to
because
be
of the
counseled. Yeah.
and tell me one thing, any other child these parents are
Yeah.
having?
Yeah. Yeah. Actually, the second time the patient, she got pregnant, but they were asked for genetic counseling and
Definitely.
chorionic sampling.
Biopsy that should be done.
And generally in the study, it is said that 50% chances are there for a child to develop beta thalassemia trait, whereas 25% chances are there that a child may develop beta thalassemia major, and 25% chances are there for a child to be a normal child. So, and the second child, by God's grace or whatever we can say, that the second
Okay.
child is normal, absolutely normal. She's not even a beta thalassemia trait case. So
Okay.
the case.
That's good. And my advice, always go for like in these type of the cases, investigation and whatsoever blood transfusion.
Yeah,
With
yeah,
that, we should give homeopathy as a supportive.
yeah,
That is
definitely.
definitely needed in these type of the cases. Okay. Okay. Thank
Thank
you.
you. Mhm. So thank you, ma'am. Mhm.
Thank you, Dr. Vinita, and I hope the inputs of the chair will definitely help you in the future prescriptions. Thank you, ma'am. Moving on to our next speaker, we have a speaker from Pakistan, Dr. Ghulam Yasin. He is the president of Seher Welfare Foundation, and he will be presenting a case of aplastic anemia cured with homeopathy. Welcome, Dr. Ghulam Yasin. You may
Thank
proceed
you
now
very
with
much.
the presentation.
Thank you very much. Can you listen me, my madam?
Yes, you are audible. Please share your screen.
Okay. Thank you very much. First of all, I want to thank the organizers of the meeting for inviting me here today. I am presenting a case of aplastic anemia. The background of the case is aplastic anemia is a rare and life-threatening blood disorder due to failure of the bone marrow to produce new blood cells and significant decrease in erythrocytes, leukocytes, and platelets causes cytopenia. And common causes are hereditary septic condition, viral infections, autoimmune diseases, and idiopathic causes. Is in this era, in the advancement in the medical sciences, we are still unable to find out the causes of many diseases. Radiation therapy. Here, I want to describe in Pakistan, especially the pole of the mobile phones, which are old in the residential area. So we are facing many problems to bone marrow suppression, and patient comes from the remote areas where the poles 4-hour-old. It's a big problem in Pakistan. For excessive use of certain drugs, yes, that is, I think so in Indo-Pak and in Bangladesh, the doctors are using extraordinary antibiotics and steroids in early ages. So the bone marrow suppression came out and the increasing of these patients day by day. Sign and symptoms: anemia, bruises, unprovoked bleeding, shortness of breath, headache, and arrhythmic heart rate, and bruises and sticky on the body. So you can see here the picture of the bone marrow cells which are destroying in this case. And purpose to this case to describe acute case of aplastic anemia using only homeopathic medicines. And patient description is a 9-year-old girl suffered with anemia and melena. She was diagnosed with severe aplastic anemia in Military Hospital, Rawalpindi on 19/10/2018 and was on regular blood transfusion from last almost 7 to 8 months, then suggested for bone marrow transplant. Relevant history is before first admission to homeopathic OPD, she was suffering with recurrent fever, severe pallor complexion, and generalized fatigability. Her HB level was at that time in our OPD 5 gram per deciliter and platelets were only 38,000. Primary complaints were weak, shaky, easy fatigued, weight loss, blood in motion, and at that time loss of breathing, shortness of breathing. She was getting multiple antibiotics and steroids and blood transfusions on regular basis before in our OPD. So initial history was at that time, she presented with pale complexion, all the signs and symptoms of anemia. Her HB level was, as I mentioned before, 5 gram only per deciliter. She had complaints of blood in stool from previous 1 month. Her platelets were 38 billion and she had fever for months on and off, which is the basic and early symptom of the aplastic anemia in blood cancers. The fever appeared continually for the months. And her WBCs were only 0.87 billion per liter. WBCs are the immune system, part of the immune system, and when they lose, they they are in lower count, the life-threatening condition is facing with the patients. She suffered with chest congestion and fever initially that was not getting better even after extensive treatment of antibiotics and steroids. Sorry, she was admitted in Children's Hospital Multan initially after the appearance of bruises and fatigue on different parts of the body, progressive weight loss and anemia. She was given extensive blood transfusion and FFPs. As she did not get better, she was referred to Military Hospital, Rawalpindi, where diagnosis of aplastic anemia confirmed and bone marrow evaluation. She was suggested for bone marrow transplant. Here, one thing that happened with the patient when they took the sample of her father, mother, and 2 siblings, 1 brother and sister, and they checked the bone marrow matching. Only 60% matching was confirmed, and doctors and consultants are mentally disturbed and worried about this one. On 60% matching of the bone marrow, is there any suitable transplantation or not? So the parents get consultation with the doctors, and they asked him to find out any other alternative treatment, and they find us on internet to read our articles of blood cancer patients. So they came our OPD clinic on 4/5/2019, and at that time her platelets were very low and there was massive bleeding in her stool, and I have prescribed X-ray 200 as a miasmatic remedy, as an antiseptic remedy, because it's an assault and constitutional failed on relief, aroused, and power and vitality, and leukemia, and where the platelets count becomes very low. X-ray have a great affinity to arouse of these cells. So with that, calcareous fast 3x and natron surf 3x have been given I have experienced in dozens cases and almost hundreds cases, pulmonary fast have a great affinity to produce new blood cells in these cases and increase the hemoglobin level and better and give better in the weakness of the patient. And with natromycin 3x, 1 teaspoon 4 times a day, because natromycin is a great medicine which works in leukemia and involve out lymphocytes when water intake have been low down. So after the first prescription, patient came after 4 weeks, 6/6/2019. Her bleeding in stools improved and her pale complexion got better. There was no need of blood transfusion in first month after the medication. She was prescribed China Q and Calcarea Fast 3X was continued because China Q was selected because the parents complained that she is not walking, she feel extreme of weakness, and she just go to bathroom and came back and lie down. So for this weakness and exhausting from a long-term disease, we select China Mother tincture 10 drops 4 times a day with Calcarea Fast 3X as in last prescription, and natromycin was waived off because her skin color and her condition was much better and her water level was now better. On 27/7/2019,
Yasin, your time is, Dr. Yasin,
yes,
your time limit is exceeding. Please try to wind it up.
okay, madam, thank you. Her appetite improved and she gained some weight, and I think so. Okay, time is too short. I went for I'm coming on outcomes. In first few weeks, the medication bleeding in her motion stopped and she started to feel much better without any sort of transfusion, and she started to eat properly and her pale complexion improved. Her weight increased slightly, and here I want to show some reports initial and after our treatment. When we want to start end of the medicine, hemoglobin level was initially 5 gram per deciliter, and now after our 23 weeks, she was on 9.7 gram per deciliter. TLC on initial report were 0.87, and now after our treatment for 23 weeks, 6.3. And platelets were in initial report 13,000, and now after our medicine, it goes to the 3,30,000. And after 2 years, when she have started Minarki, we asked him to for last report, and after a few days before they sent us to last report, and her hemoglobin level in this report is 12.1, and TLC is still 9.9, and platelets are 186, which are excellent, normal in health, and she is going normally with periods, and there is no ticky and there is no reoccurrence of the any symptom. Thank you very much, madam. That's all but from my side.
Thank you,
Any questions?
Thank you, sir. Over to the chair for further questions, please.
And Dr. Ghulam Yasin, as you said, this is a case of aplastic anemia. Can you please tell me when the patient came to you, before that, at what time the patient has taken the blood transfusion? So just before coming to you, or it was a few months back he has taken the blood transfusion?
Okay, madam, thank you very much. She was on blood transfusion from last 8 months, 7 to 8 months, and multiple transfusion was given in Multan
How
Children's
long? After
Hospital.
how much time the patient needs blood transfusion?
After 15 days to 1 week or 15 days, maximum 15 days.
Okay.
And he have multiple transfusions.
Okay. So after giving the prescription, as first prescription you have given on 4/5/19. Okay.
Indeed.
And the second prescription was on 6th June. So
Yes.
in between that period, how much time she requires blood transfusion? She requires blood
Madam,
transfusion,
after
or with this medicine there was a lot of improvement?
Madam, after start of our medicine, still today, after 2.5 years, she has no need of blood transfusion. she is still normal, healthy and wealthy.
Okay. And that in between, like the prescription which you have given, whether it is X-ray, calcarea phos, so you have tried to give some constitutional remedy in this case or not? I just want to know.
I'm working on blood disorders from last almost 15 years,
Hmm.
and I have experienced this one. When I started some other medicines, the results are not like this criteria fast. And in exhausting diseases, I ever use from the anti-miasmatic remedy, especially anti-syphilitic remedy in the blood cancers and blood disorder cases. And calcarea fasts have a great result in all cases when the all the phenomena has exhausted and weakness is there and blood counts are very low. So I ever use in first condition calcarea fast in low potency, so results are excellent.
Okay, so that is we can say that is your study in which you have find out that calcarea fast many cases you have seen. That's why,
Yes,
or the indications of instead of constitution, we can conclude with this key instead of constitution, it is better if we go with this constitution, calcarea fast, natrium self, or start with the X-ray lot of exposure and all these things.
yes,
So this
madam.
is
Initially, I have started from the constitutional level, but the result was not satisfied. And after a long-term exercise, I have used now antisyphilitic medicine and criteria fast 3x in low blood count and in thalassemia patients. As my before I heard the speaker, okay, she have attending
okay.
the
Could you
thalassemia
please?
patient. We are also attending thalassemia patient, and in low hemoglobin level, criteria fast 3x is the best.
Okay, could you please tell me whether this patient was taking some of the supplement to increase the immunity or some kinds of things or any allopathic treatment along with our homeopathic treatment?
No
Whether patient
medicine,
was taking
no,
that also? Like
no madam,
recurrent infection and these things are there, maybe patient need in between antibiotic or just he
no
was
madam.
totally on homeopathic.
No, madam. After our starting of medicine, we strictly ask the patient that no medicine they can use during our treatment. So no medicine was there.
Okay, okay, thank you, Dr. Guna. Thank you so much.
Thank you, madam.
Thank you.
So now moving on to the next speaker. May I now invite Dr. Dilip Soni, consultant at Jaipur Homeo Clinic, India, and he will be presenting a case report on the a case report titled "A Challenging Case of Coma, Coronary Artery Disease, Acute Coronary Syndrome, ST elevation, Myocardial Infarction, Cerebrovascular Accident laced with streptokinase, treated with a novel approach in homeopathy, the mind of pathology." Welcome you, sir. You may please now
Hello.
share your screen. Sir, you can
Yes.
start your presentation.
Hello. Yes. I'm going to share mind of pathology, a concept which is forgotten concept, but we are trying to uh, regionalize this concept, and in which where the pathology is considered as an individual identity, just like an human being. We have tried to bring this forward. Every disease has its own mind, body, individual characteristic like location, structure, shape, age, mental faculties like memory, will, sensation, sensitivity, etc. For its better survival, means the pathology considered as just like a human being. For example, an ulcer may be round, punched out, irregular, zigzag margin. Similarly, like tumor have different shapes, round, rough, hard, soft, and different locations, etc. So all these pathological differentiation represent the actual mental state of the patient. Means we go to the mental symptoms of the patient through the pathology also. We are initially concentrate on the pathology first and try to understand the pathological message of the body Then we consider the relevant mental and general symptoms and understand the trio of the disease. Trio means that the symptoms of medicine, the symptoms of disease, and symptoms of general as a mental and physical. Means both three are in a one line. We want to make a one line between these three. So mind homeopathy medicine in totality. This help us in selecting the proper simillimum by choosing the relevant mental and physical symptoms as a general symptom. So the case taking and selection of medicine is more precise, especially in critical cases, and the result are rapid and gentle as explained in our cases. We have achieved success in many cases and have among them 5 cases I am going to present as a case series. In first case, patient has CAD, MI, CBA, ICH, left-sided hemiplegia and in comatose condition. Here, I consider the mind of pathology, means the what pathology want to convey. That in this case, we have decided that the patient have fragility at the capillary level of brain as well as heart as well as liver. The, we observe this by the investigation. At the same time, we analyze that the fragility was also present at the general mental level, and patient become rigid and broken down after a major financial loss that we have got in the history. The Thuja 01 was prescribed and rapid recovery, and 24 hours patient regained the consciousness, and after 4 months, patient was absolutely normal. That is stable till today. The condition of patient is stable till today. In the second case, the growth of urinary bladder wall with UTI and passing the gelatinous materials with the severe weakness in the patient with agonizing pain. The patient sacrificed UTI and severe weakness. The patient sacrificed his room for as his territory for his newly married son, but his mind did not accept this and hence developed the pathology. URC30 C was prescribed. Dysuria improved within 2 days and growth disappeared as observed in normal ultrasound within 2 months. In the case 3, in case 3, the case of fibroadenoma right breast. The right breast depict the partner area where the tumor was found. In her mind, she had insecurity about her husband's survival and she was protecting him. Tumor is a growth represented to increase the surface area to purpose of shielding. On the basis of this, he perceived 200 C single dose was prescribed and tumor was disappeared within less than 2 months. Another case, the diverticula and diverticula is a small bulging pouch in the lining of digestive tract. At the level of pathologist, cells want to form new stomach. On the level of mind, she had delusion that the food that she was eaten was not enough in her. Hence, needed extra pouch to accommodate additional food. On the basis of this, Merck 200C single dose was prescribed and the totally recovered was observed in about 4 months in this case. And again, one case, this theory is also can be utilized in the fetal life also. The redistribution defect of middle cerebral artery in a fetus, the vital organs of the fetus have sacrificed their blood flow for the sake of brain. The mind of pathology was seen in mother, where food, where the mother sacrificed the attention of fetus for the elder son who had a major illness and underwent surgery, and Bothrop's 200 single dose was prescribed and circulatory homeostasis was maintained in the fetus within a week of time. So here I conclude all the cases that the conclusion is the method can be used for the rapid analysis which ensure speedy recovery in all cases, including many critical ones. However, being at conception stage, mindopathology require further research as we think. So when a lot of the practitioners are in dilemma that we have lot of mental symptoms, but we cannot choose the correct one. So we are searching haphazardly. So what mental symptom we should consider? The pathology tell us that this mental symptom is important, and this physical symptoms may also be important. So we can achieve the cure by the vice versa situation. So this is my presentation. Thank you.
Thank you so much, Dr. Dilip Soni. Over to the chair for questions, please.
Okay. Dr. Dilip, as you said, we start just with the first case, okay, in
Yeah,
which you have made the diagnosis of the patient. Patient is, you can say, it is a challenging case for the homeopathy.
exactly.
So patient will be having all those, you can say, CADs, there, hemiplegia, and all those condition, comatose condition, CAD also. So in these type of the cases, as you said, ki patient is having a history of the MRI also. Not MRI, history of the mitral, you can say, uh, acute attack of any heart disease was also there, myocardial
Yeah,
infarction or like
yeah,
that patient
yeah.
or not?
Yeah, he was in
Which
MI, and when the process was going on, that time patient went in coma.
that time patient went in the coma. And in these type of the cases, as you have how long you are following this case?
It is still going on. The medicine was stopped before 2 3 years, I think so,
You have
and
followed
that
it
it,
for
it
2 3 years, this
yes,
case,
followed without medicine,
without the medicine, without any
yeah,
allopathic medicine. And
without
these
any
type of,
homeopathic as well as allopathic medicine.
as well as allopathic medicine,
Yes,
okay. And just to say ki to how much level the patient is better, we need the angiography, and whether it is CT scan also, CT angio, these are the investigation which are needed in these type of the patient.
yeah.
So all those investigation the patient is going on, because
Patient,
pathology in these
patient,
type of the cases, it is very difficult to revert. Although symptomatic relief, we can say it is possible, but
we have some investigations in which ECG and some more like uh, uh, like USG and these kind of uh, the investigations are there, but
I just want to know whether it
yes,
is just
yes,
at the level of the ECG or some more, because ECG is even contradictory also. Many times ECG is normal, but even then the patient is having, you can say, the heart block or some time of the those type of the symptom, which will be clear
yes,
after whether angiography or it is echo,
yes,
which will be helpful
we
to some extent.
yes, yeah, we have echo, and echo was normal, and but we have not MRI or CT, because when patient was normal, he was denied that I do not want to go for the further investigations. But patient is absolutely normal. I have all videos follow-ups with me.
Okay, because in the
It
changes
is
are,
it
we
is
are
it
seeing
is
the
just
changes in MRI also. So repeated MRI was also done to see whether these changes have reverted back or not.
yes, it I think so. It was revert back, but I have no evidence because for this, because MRI was not done by the patient, but the general condition of the patient is absolutely normal.
Okay.
As
So,
patient is still is on his working, that is very almost impossible in these kind of the cases.
okay. And in that case, you have prescribed Thuja.
Yeah,
Okay. How long the Thuja was given to the patient?
Thuja given BD initially is external application because patient was in comatose condition, and
Okay.
then it was oral for
Okay.
around 4 months. After 4 months, all medications been stopped, and the patient is still normal, and he is coming just for checkup around 6 months, 1 year. He is coming and send many patients to me.
Okay. And in this case, first case, still we continue. Whether the basis of the prescription for the Thuja is just the antipsychotic medicine, or it was a constitution on the basis you have selected this remedy?
No, I consider the mindopathology.
Okay, mind of the.
If mindopathology is considered, means the disease itself have its mind. It's expressed itself, but our antenna must be strong that we should capture that.
Okay,
So fragility is everywhere because I have seen the CT as well as angio everywhere. There is the capillaries are burst, means there is tiny hemorrhages in liver, in heart, as well as in brain. So it means the fragility is there. Means we should search the fragility at the mental level, general mental level, and that fragility I got, and from there I certain that Thuja should be the medicine, and it was just a miracle.
okay. And in second case also, like the patient is having growth in the urinary bladder.
Yeah.
Okay. So the 61-year-old, so in that case, the growth in the urinary bladder was there. So can you please tell me whether biopsy was done in this case or not?
No,
Any
biopsy was not
reports?
done. Biopsy was
Biopsy
not
was
done.
not.
Patient was not agreed for that,
Okay.
and it is the sonography that I have shown in my slide.
Okay. And after the treatment, the patient was much better.
Absolutely normal.
Okay.
Right now, he is
And
absolutely
repeated
normal.
sonography has shown that it is just a
Yes,
normal urinary bladder.
yes, yes.
Okay. So in most of the cases, what we are saying ki pathological, or you can say the pathological changes are there,
Yeah,
whether it is a case of the fibroadenoma, Hipersulf
yes.
200 and all those prescription. So you are just, I just want to know whether you are just continuing with a single homeopathic prescription or intercurrently some more are required.
In first case, I use pyrogenum 200 once because patient has a severe fever, and
Hmm.
doctor said it might be septicemia. That time I use pyrogenum 200 single dose. Second day patient was normal, so no need to repeat that medicine.
Okay, like in fibroadenoma,
No
Hipersulf
medicine, no
200,
medicine, only if itself.
no medicine till now, and that
Yes,
swelling and everything was better.
yeah, absolutely okay.
Okay, and just as you said, I just want some clarification at that level. Like it is, you are just merging the pathology of the mind. Okay,
Yeah,
that is one of
no,
the important, you
no,
can say, homeopathic
mind of
part.
pathology.
Challenging, you can say challenging challenge for the homeopathy.
Yeah.
So I just want to know, like mental symptom which you are taking. So on what basis? Many times we don't give importance to this mental symptom or that. So any some you can say you can guide your friends or on this platform ki
Ex-
how it is possible or how you make it possible.
Because once you take the mental symptoms from the patient, then we got many mental symptoms, many syphilitic, many psychotic, many soric symptoms. So we are just confused because when we asked any practitioner for a particular case, then different practitioner give different medicines because everyone gives according to their thought. They give importance to that mental symptom and repertorize and give the medicine. I just make a line between the pathology, mentals, and mentals of medicine, physicals of medicine, physicals of body, and physicals of disease also. Just make a single line, then
Okay.
we can get the correct simulum in fast and quick way, and the case taking also maybe uh, come down in time. Means if you want to take in these critical cases, if we spend 2 hours 3 hours, then it is very difficult to manage. And in these kind of the process, we can within 5, 10, 15 minutes we can
Okay.
reach to the correct
Any
medicine.
particular repertory for this which you are using?
No, I'm general repertory, radar, and
Okay. 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 Okay, sir. That is, these cases are very challenging for the homeopathy,
we have
definitely.
treated around more than 100 cases by this method, but it is very difficult to convey this all large method in
Definitely.
7 minutes. It is very
But
difficult.
I think my advice is recurrent, all the upgraded investigation should be done in all these type of the patient, because here just to make it evidence based on the basis of the symptom we just always cannot say definitely it is also helpful for the homeopathic point of view also. And otherwise patient is not having any acute exacerbation of the complaint, so that is the achievement for us. But with that also, if we are making it all those type of the critical cases and challenging cases in repeated investigation, so we can say with great authenticity to all, even conventional and all the pathies, okay, this is our achievement even in these type of the cases. That is very good, I think. And these type of the
Exactly,
cases, if we are
exactly,
able
ma'am.
to do, that is very good for homeopathy.
Exactly, ma'am. We are following this phenomena nowadays, and we have all documented cases and records, and we are we are going through this process.
Okay, thank you, doctor. Thank you,
Thank you.
Dr. Devi.
Nice.
Thank you.
Ma'am, with your permission, can I clarify something from Dr. Dilip Soni?
It is definitely,
Yes, ma'am.
Dr.
Yes.
Archana, definitely.
Sir, it means for every case of fibroadenoma, we can prescribe Hiperself 200?
If the location and the the shape of the tumor and the location of the tumor, if it is same, and of course if patient have the same symptoms, same location, it means the mentally both patient have the same trauma, means same medicine we can prescribe if there is mentals are agreed at general level.
The pathological mental symptoms you are talking about.
Exactly.
Okay, sir. Thank you.
Pathological mental symptoms should be matched with the general body mental symptoms and also with the medicinal symptoms, medicinal mental symptoms.
But sir,
If
one
we
thing,
make, I have already said, if we follow the tribe.
Okay, sir. Thank you.
one thing, it means in these type of the cases, as you can say, the same medicine could be used in many of the cases.
Yes, if there is,
Because
because
we are
the,
basing on mind and pathology.
yes, mindopathology and mindopathology, if make a triangle, means make a line between these three, then we should prescribe the Hiperself 200 or Hiperself 1M, decided according to the sensitivity of the patient.
Okay,
If
so it
sensitivity is
means,
agree, then we should go for that.
so according to you, it means it will, you can say,
It is
save the
not a
time, and the
specific.
concept of individualization is not so much required in these type of the cases. Just when the
Yes,
pathology is there, according to that, we can give our
we
prescription,
should
pathology and mind.
individualize the pathology.
Individualize the
If we
pathology,
individualize
not
the
the
pathology, then
individual.
it must be follow the individual individualization also. It must be.
Okay.
So we can blindly tell patient that you have this kind of the pathology and you have these kind of the mental symptoms, uh, and patient say yes. How do you know that?
Okay. Okay, doctor. Okay.
Thank you, ma'am. So nice.
Thank you, sir. Thank you so much, sir, for your inputs. Now, may I invite Dr. Jayashree Nanda? She is working as reader in the Department of FMT at Dr. Abhin Chandra Homeopathic Medical College and Hospital, Bhubaneswar, Odisha, India. She is presenting on homeopathic approach of chronic obstructive pulmonary disease, type 2 respiratory failure, and obstructive sleep apnea in an obese person. Dr. Jayashree Nanda, are you there?
Yes, ma'am. Good
Yes, you may
afternoon.
please share your screen and you can start with the presentation.
Good afternoon, all of you. I am sharing my screen now. So, this is my presentation that homeopathic approach of COPD, type 2 respiratory failure, and obstructive sleep apnea.
It is not clearly visible. Can you please enlarge it a little bit?
Okay, ma'am.
Yeah, now it's okay. Yeah, please start.
So there are a relationship between obesity and COPD. It is an epidemiological study reveals that 50,000 patients have a prevalence of obesity, but significantly higher in patients with COPD than in those without COPD. Here, the pro-inflammatory mediators are common in both cases, so there are some relations. So more than 1/5 of the population of United States and approximately 60% of obese individuals have a metabolic syndrome. So can I hear you, madam?
Yes, ma'am, please continue with your presentation. You are audible.
Yes.
Please continue.
So my aim is here to evidence-based case report to show effectiveness of homeopathy in an obese person with respiratory failure. So the method is to take the case and prescribe. The presenting complaint of the case was on 22nd April 2001, a male person aged 76 years with difficult respiration and shortness of breath has discharged from hospital with oxygen and BiPAP support, having saturation of oxygen is 87 to 88% without with oxygen, and without oxygen support the saturation pressure is it diminishes to 67%. He had stertorous breathing and dyspnea and the generalized edema with also severe drowsiness. Then history of the case is before 15 days he stayed in hospital in ICU for 5 days with intubation and 5 days in cabin with NIV and BiPAP support. For some complaint, for the same complaint and discharged with the oxygen and BiPAP support after stabilization. So his under general examination, his weight is 120 kg, height 165 centimeter, pulse 100 per minute, blood pressure 134 per 90 millimeter mercury, anemia double plus, edema double plus. He had dull sound on percussion throughout the chest and faint breath sound and heart sound on auscultation due to bilateral pleural effusion. Physically, he reacts both heat and cold, catches cold easily, desires for sweet, thirstless, and his stool is blackish, soft, and alternate day. Sweat from whole body and sleep apnea is there. Mentally, he is irritable, arrogant, selfish, and company desires and fastidious. Investigation, blood, hemoglobin is 7.5 gram per deciliter, TLC 9,000 per cubic millimeter, TRBC 3.64 million per cubic millimeter, D-dimer is 2.67 mu per ml. Kidney function test, serum urea is 62.4 milligram per deciliter and creatinine is 0.81 milligram per deciliter, which is high. The urea and creatinine is also in high level. The COVID-19 test is negative. HRCT test reveals mild to moderate bilateral pleural effusion with passive atelectasis of underlying lungs, left-sided cardiomediastinal shifting. USG of abdomen shows moderate hepatomegaly and mild diffuse fatty change of liver and cholelithiasis. Echo findings shows concentric LVH, no RWMA, good left ventricular systolic function, left ventricular failure is 60%, grade 1 diastolic dysfunction. Diagnosis is COPD, OSA, type 2 respiratory failure with obesity. After reportorial analysis, the arsenic, kali carb, lipo, and phosphorus and calcarea carb are in series. As per the totality of the case, kali carb is selected as for first prescription. So on the first date, on 22 April, I prescribed kali carb 0/2, 1 ounce 8 doses OD, then Grindelia Q 15 drops BD, Antimtat 200, Lauroceresis 30, and Epis 200 each in 2 drops in OD doses. On 30 April, he can sustain respiration for 45 minutes without oxygen, so much improvement. So without oxygen support, the partial pressure of the saturation pressure of oxygen is 89 to 92% without oxygen, and with oxygen support, the saturation oxygen is 93 to 94%. Stertorous breathing is completely absent. He can inspire oxygen but cannot expire. The bed sore gradually develops. On percussion, resonant sound heard throughout the whole chest, which shows there is no effusion, which was previously dull sound on chest on percussion. The prescription in this date is Calicarb 0/3, 1 ounce, 8 doses OD, Carbovix 200 for bed sore development, Laurocerases 30, 2 drops OD, sulfur 30, hydrocyanic acid 30, Sambucus 30, all are in OD doses prescribed. After 13 days, the patient can sit 2 hours without oxygen support. Epigastric tenderness present, appetite less, stool black and ineffectual. Blood report shows hemoglobin gradually diminishing, that is 6.8 gram%. On examination of the stool, there is occult blood positive. So I prescribed Noxvomica 10 mg 1 dose, then lecithin 3x, Ferromet 30, Ferrompos 6x. These are for to increase the blood level, and Laurocerases 30 is given, that is continued. Leptandra is given for Malina, and Calicarb 04 is continued. Then on 26 May, the fever comes at midday and with chilliness, that may be due to catheter fever, and the blood pressure is 126. Pressure, saturation pressure of oxygen become 97% without oxygen support. Means the patient is completely in stable condition. The pulse is 109 per minute, maybe due to fever. And the prescription is prescribed for urinary infection, that is arsenic 01, and this lecithin, Ferrompos, these are continued, and Lachesis 200 is also prescribed for Malina. Then on 12/6, the morning temperature become 99, but it increases towards evening. Then the thirst is normal, the stool become yellowish, and catheter is removed. On these days, the urine shows there is a still infection, that is pustule is 94, WBC clumps are there, RBC present, bacteria 4+, so there is urinary infection is present, but the stool report shows occult blood negative. Here, due to same urinary infection, arsenic 02 and Epis 200 Cantharis are prescribed with Ferrompos and lecithin. But in 15/6, the temperature still remains, so I prescribe Pulsatilla 02 because there is thirstlessness and anorexia along with burning micturition. Pulsatilla and Equisetum is prescribed with Cantharis. Then on 9/7, there is no fever, the urine become normal and appetite become normal. No need of artificial oxygen. Bed sore also healed. The urine on urine examination, pustule nil, clump nil, and bacteria only single plus. Calicarb 05 and 06 continued for another 1 month. Ferrompos and lecithin also continued. On 13/9, the kidney function test, blood urea completely normal, 12.95 milligram per deciliter, creatinine 0.61 milligram per deciliter, D-dimer is 0.85 μg per deciliter, which is too much reduced, and hemoglobin is completely normal, 14.9 milligram per deciliter, TLC is 9.1, TRBC is 5.1, and DC is also completely normal. So the patient is a multi-organ failure, and the hospital discharged him. There is no hope of recovery. By the homeopathy medicine, the patient is completely cured. These are the discharge report, and the diagnosis is here written, and these are the discharge summary by the hospital, treatment taken, and here is the hemoglobin. Before it was 7.5, and after treatment it is 14.5, and here this stool for occult blood, it is detected, here it is negative, and here then urea creatinine, here it is very high, 64, and here it is reduced to almost normal, 12 milligram. per deciliter. Then here the urine report, here on bacteria Posel is 94.
Jayashree, Dr. Jayashree, please try to finish the presentation.
Yes, sir. Yes, madam. So D dimer is also 2.67 and it is also normal here. And the here this is on 24, it is 71 without oxygen, and with oxygen it is 88, and in 29 it is without oxygen, and with oxygen support is 94, and on 24/5 it is 97%. There is no oxygen is needed. So according to Hahnemann, aphorism 92, that without delay in rapid course of disease, observe the medicinal and original disease conjointly and combat it with a suitable homeopathy medicine. And according to aphorism 247, repetition of dose is followed. And according to aphorism 248, change of remedy, which is in multi-organ failure, we can treat successfully by homeopathy. So I thankful to the patient Pulamani Mishra and my professor Dr. Niranjan Mahanti and research officer Amulya Sahu and my student Dhaneshwar Sidhu. So thank you. Thank you, madam. And thank you all.
Thank you, Dr. Jayashree. Ma'am, Dr. Seema Rai, do you want to ask any questions from Dr. Jayashree?
Dr. Jayashree, in this type of the cases, because the COVID the patient was having, so you have given the prescription, first prescription when he was in the hospital or he was discharged from the hospital?
After discharging with the hospital, discharged him, there is no hope of recovery. COVID test was negative there. They tested their COVID test
so
was
they
negative.
have discharged with the oxygen support the patient.
Yes. The oxygen, with the oxygen in converter machine and BiPAP machine, the patient come to the home. And this photography is in his bedroom. The patient with this bed, hospital bed, everything they buy for the patient. His son buy everything in the bedroom. I manage the patient.
Okay. So you
With
have to visit these type of the patient.
Okay, madam.
Okay. And tell me, like all the what I am saying, you are giving the prescription. That's very good with the homeopathy. These type of the cases, hopeless cases, also that is a great achievement. Although, but every time what I am seeing the prescription, many prescription, and you can say what was the basis. Like even first prescription Naxwamika 10 mg. Lecithin, ferrometallicum, ferrimphos, lorocerosis, leptendra, so Kalikab, these type of the 8 doses. So how the patient is able to manage taking these medicine along with whatsoever allopathic medicines are also going on and management also.
So, allopathy medicine they only prescribe for 5 days, 5 to 8 days. After that they finish, and they, because there is no hope of recovery, they tell do not come to us, we have no medicine. So I have chance to treat the patient.
Definitely. And that's why, because it is very difficult to take these so many medicine in a day.
Exactly. I will prescribe each symptom one medicine. Each symptom one medicine, because there is no hope. Then we will try if there is any chance. Any chance. So
definitely that could be. What we can do with homeopathy, although with this we cannot just conclude ki these type of the medicine or these sets of the symptom are helpful, but we can say
within 3 days, within 3 days the patient gets his respiration rate is improved by this pulse oximeter. You can see the very rapid improvement.
Definitely improvement is there, but we cannot conclude with the some sets of the medicine, definitely lot of the medicine, but achievement is this with the homeopathy, a hopeless case, we have done something and we are able to improve. That is that's good. Okay. Thank you, Dr. Jayashree.
Thank you.
Thank you.
So moving on to our next presenter. Next speaker is Dr. Renu Mittal. She is working as a research officer at Central Council of Research in Homeopathy, New Delhi, India. And she is presenting on homeopathy in the treatment of tuberculosis clinical experiences. Welcome, Dr. Renu. You can share your screen and start the presentation, please.
Good afternoon, everyone. I am audible.
Yes, you are audible.
Yeah, good afternoon, everyone. My topic presentation today is homeopathy in the treatment of tuberculosis, clinical experiences. As we all know,
But your
TB is the
poster
one.
is not, Dr. Renu.
Yeah.
Your poster is not clearly visible. Yeah, expand it a little bit. Expand it. And then you can scroll it up and down.
Okay.
Yeah, you can now start. Again,
Is
it
it visible
is.
now?
Can you expand it more?
Is it okay?
Okay, just start it. All right.
Yeah. Yeah, as we all know, TB is the world leading infectious disease, claiming about 1.4 million lives of people in 2019, and there were more than 10 million active cases each year. In India, 2 million people develop TB every year, and out of which 0.87 million cases are infectious. Globally, 465,000 people fell ill with drug-resistant TB. The emergence of new bacterial strains resistant to previously effective anti-tubercular drugs have threatened the progress made in the TB care and control. The objective of this poster is to consolidate and examine the current level of evidence for homeopathy in drug-resistant TB. In the table, I have shown there are data of 6 studies which have been published in the peer-reviewed journals from 2011 to 2017, showing role of homeopathy in the treatment of TB and tubercular lymphadenopathy cases. 03 are the case reports at serial number 1 and at serial number at the serial number 4 and serial number 3. These are the three case reports, wherein the data of 11 cases of pulmonary, spinal, intestinal, and genital TB have been presented. All of these cases were drug resistant or drug intolerant cases. Homeopathy was given as an add-on to standard treatment or as a standalone with a positive outcome and reducing the duration of treatment. 1 is the case series of 25 cases of tubercular lymphadenopathy, which have been published in the journal Homeopathy, where individualized homeopathy and an organic specific medicine and tuberculinum bovinum 200 was given as an intercurrent. The results were the lymph nodes become impalpable with more than 75% reduction in size. And apart from this, there was weight gain, an increase in hemoglobin, and a reduction in ESR. Another pilot study of 145 SCAT2 failure cases, which means the cases which have been previously treated smear positive cases, which are again positive due to drug resistance or interruption in treatment. This study was conducted in a TB hospital in Delhi, and the homeopathic medicine was given as an add-on to the anti-tubercular treatment. The conclusion of these studies was there was improvement in symptoms with reduction in acute episodes of the symptoms of tuberculosis like cough, breathlessness, hemoptysis, etc. And out of this observation of the 142 cases, 15 homeopathic medicines were shortlisted. Based on the result of this study, observational study, a double-blind, placebo-controlled, randomized controlled trial was undertaken on the multi-drug resistant tubercular cases, wherein homeopathy was given as an adjuvant to standard conventional care. This study was funded by Delhi Homeopathic Anusandhan Parishad, Government of LCT of Delhi. Under this study, 120 diagnosed MDR TB cases, which means the cases which were resistant to 2 or more than 2 second-line anti-tubercular drugs and which were diagnosed by the sputum smear and culture and sensitivity tests, were enrolled under this study. As per the homeopathic intervention, as a double-blind study, we prepared the identical batches of the 15 predefined homeopathic medicines and placebo, and the patients were randomized. The duration of treatment under this study was 24 months, and the outcome assessment parameters which were used were the sputum smear and culture conversion from positive to negative. Cases were also assessed as per the TB control guidelines, which are defined as cure, treatment failure, and the defaulter cases. We also analyzed for the hemoglobin, ESR, weight gain, and the resolution of symptoms. For the radiological changes, a radiological assessment tool was developed using 3-point Likert scale, which is shown in the table. And this was developed on the basis of the change of infiltration, size of lesions, number and size of cavity in the fibrosis. Because and most of the cases are having the cavities or having the infiltrations in more than one areas. So these were this was the selection. These were the outcome parameters. Apart from this, we also tried to know if there is any difference in the time to culture conversion. That is, the duration from initiation of treatment to 2 consecutive negative cultures was also assessed. Now coming to the results of this study, in the cases of there was no significant difference in the groups of for sputum smear and culture conversion, that is from positive to negative, but the culture conversion was more 10% in the homeopathy group, which shows that there was the cure rate was 11.4% more in the homeopathy group, and failure rate was 9.9% less in homeopathy group. There was statistically significant difference was seen in the X-rays in the homeopathy group. As we see the blue line, this shows that 61.7% cases have improved in X-ray, and in the placebo group, only 33.3% cases showed improvement, and the p-value was 0.002, which was significant. Similarly, for the cases of the changes in the mean change in the weight hemoglobin ESR, there was a statistically significant difference in the which was in favor of the homeopathy group, and which show there. And the third one is this Kaplan-Meier. If I'm able to zoom it, this is the Kaplan-Meier curve. This is for the time to culture conversion. The red line which is shown is for the homeopathy group, and the blue line is for the placebo group. When we compared both the groups, we find out that there was no difference in the time to culture conversion in both the groups, but still the time to culture conversion in the homeopathy group was less, but it was not statistically significant. Based on this, we were able to draw certain observations, which were like that the symptoms of the patient in the present study were a combination of the symptoms of the disease and iatrogenic effect of the prolonged use of HET drugs. Suitable acute remedy often help the patient having acute episodes of hemoptysis, breathlessness, and fever, but also with the conventional drugs. Patients with only constitutional remedy were slow. Progress has been faster when tuberculinum was added as an intercurrent remedy. When the improvement has stopped, patient treated with the medicines, with the constitutional medicines, along with the tuberculinum as an intercurrent, has shown maximum improvement. And the episodes of acute element with indicated remedy, apart from the constitutional,
Dr. Renu, please
conclude the progress of the cases. Yeah, I'm concluding. Management and randomized control trial with multi-drug resistance regimens in MD or TB are therefore required. Further basic research, animal experimentation, and immune marker studies are needed to validate the treatment effect. Thank you.
Thank you, Dr. Renu, for a wonderful presentation. Now I request Dr. Seema Rai if she want to ask something.
Okay, Dr. Renu, very well presented the role of homeopathy in treatment of the tuberculosis, especially drug-resistant tuberculosis. But I want to know one thing, that in most of the cases, you have prescribed just the tuberculinum as the intercurrent remedy, or some any other nosode or any miasmatic remedy was given as intercurrent.
No, ma'am. In all the cases for the as an intercurrent tuberculinum, 200 was only given because
And
these were
tuberculinum
the
200,
15.
just one dose was given, or how you have repeated it?
Ma'am, it was only one dose was given at a time, and it was only when when we during the follow-ups. After every day, we used to follow up the cases, and during the follow-up, if we see that after giving the indicated constitutional remedy and the patient is not responding, and we are not able to see improvement in the cases, then we prescribe the intercurrent remedy off and on fortnightly basis, not a regular
Okay,
basis, a single
okay.
dose.
Okay. And like in these type of, although you have gone for all X-ray and to make it more evidence-based X-ray and all those to see the filtration, fibrosis, cavity or infiltration, you just let me know कि you are able to chalk out with some of the acute medicine in these type of the cases.
Ma'am, the
You are
acute
able to
medicine,
shortlist because so many studies you have participated,
yeah.
which will be
Uh,
helpful for everyone.
Yes, ma'am. The acute medicines which we were able to chalk out, and these were the like Ipecac, arsenic album 30, Nux vomica. These were the medicines which we usually use for the side effects of the allopathic conventional drugs which the patients were under, because all of the patients under the standard conventional treatment were usually taking 4 to 6 antibiotics like rifampicin, pyrazinamide, ethambutol, ethionamide, cyclosporin. These all medicines were having a lot of side effects on the liver function tests also. The patients used to suffer from itching and the pruritus and the nausea, vomiting. Sometimes suicidal tendencies also were seen in the cases. Though these things cannot be reported,
Hmm. So
but
it means with our homeopathic, you have tried to do the clinical verification of other symptom also, as you are saying, at the mental level also,
yes,
and whether it is not only suicidal tendency, it could be depression, indifferent to the family, loneliness, lot of complaints the patient
lot of
may
complaints.
develop. So
Yes,
patient with your so many studies which you have conducted, are you able to find out ki patient is getting relief at the mental level also? Physical level we are able to assess as you people are doing. So
yes.
mental level also you have tried to compile the data ki at mental level also patient is having these type of the relief. You have
When
tried to
both of
compile that data also, because so many studies, lot of
yes,
studies have been
yes.
conducted by your team.
When usually the patients which are taking that these type of cases are usually they have got given up, and sometimes the cases were like that. All of the family members were involved. So there was
Definitely.
so much of hopelessness was there. But in the randomized controlled trial, the double-blind study, we have a limited 15 medicines which we have shortlisted. So we were not able to prescribe any specific medicine based on the mental symptoms. We have to be fixed from these 15 medicines which have been shortlisted and this under this trial.
No, no, I am
Even
not asking about the mental prescription. I am just asking whether with whatsoever medicine you have prescribed. Because
yes,
TB patient, especially drug-resistant TB, they must be having lot of the symptom at the mental level also. Whether
yes,
you
ma'am.
have compiled that things also for the other people's. Ki with the homeopathic treatment, not only there will be better or the patient condition is better at the physical level or the symptoms of the tuberculosis or drug resistant tuberculosis, but the patient is also better at the mental level. So I want
Ma'am,
to know whether clinical verification, that data also you are having clinical verification of those symptoms also, because that is also very good.
yes,
You can
yes,
say if we compile that data also,
yeah,
that
ma'am,
has
that
been done or
data,
not?
no, that has not been done.
Okay,
But
okay.
in the
But
further
my
studies, we
advice, if it will be
will,
done,
yeah,
that will be, you can say, in the homeopathy, we used to say, Sone pe suhaga. That will
yeah,
be
ma'am.
evidence based and at the mental level, because still, even today, tuberculosis patients are having, although as per the ancient time, it is not their social stigma, but even then, that thing is also still going on.
Yes,
So, my
ma'am.
advice is, if that will be better, that is also a very good compilation,
Yeah,
also along with
yeah,
this. Thank
yeah,
you,
ma'am.
Dr. Roy.
Yeah.
Thank you.
Thank you, ma'am. Thank you for the session.
I thank all the organizers for this wonderful session, And I thank all the participants for their excellent work and presentations. All your posters will be available during the colloquium from 10 to 12 in the poster hall. And you have the option of interacting with the participants and the experts through the chat board. I thank our chair, Dr. Seema Rai, for sparing her valuable time for the session, and I request her for her closing comments. Ma'am, please.
Okay. Thank you, Dr. Meeta and Dr. Archana, for being there as a moderator, and very good work was done by the whole, by yourself and the whole team, I will say. And the whatsoever presentation, I think 3, 6, 8 presentation, we can say some are very good. And I will say if we are having the, you can say, all the posters or presentation with the evidence, so we can say with the proud homeopathy is equally effective. So my suggestion is this: if we try to make every presentation evidence based, that will be very good. And otherwise, great, it is very informative. Many of the challenging cases we have also seen, the hopeless cases, what homeopathy can do. Just that is a great achievement for the homeopathy also. And all these information will be helpful to so many, all of us, those who are attending. And even after that, if we listen to them, definitely it will add, you can say, add to our whatsoever knowledge we are having, that practical knowledge which we are getting from these presentations. Thank you.
Okay, now I hand over the session to Dr. Thankraj for moderating the next session. Thank you.
Thank you.